About 8 lakh people all over the world commit suicide every year. And surprisingly, 17% out of them, that is more than 1,35,000, are Indians. Every hour in 24 hours, one student commits suicide. That is 28 students almost commit suicide per day in our country. And around 381 people commit suicide per day in our country. Risk factors for suicide in our country are namely domestic violence, that is rape, dowry, etc. Suicide motivated by politics. Suicide motivated by mental illnesses such as depression, substance use, etc. Farmers' suicide in India. Student suicides due to academic expectations and pressures, ragging, etc. Family history of suicide or mental disorders. Stressful life events such as loss of loved ones, legal troubles, financial losses, etc. Identifying warning signs and triggers of suicide. Talking about wanting to die or wanting to kill themselves. Talking about feeling hopeless or having no reason to live. Talking about feeling trapped or feeling that there are no solutions. Feeling unbearable emotional or physical pain. Talking about being a burden to others, withdrawing from family and friends, giving away important possessions, saying goodbye to family and friends, putting affairs in order such as making a will, taking great risks that could lead to death, example rashly driving, dangerous locations, etc. Talking or thinking about death too often. Making a plan or looking for ways to kill themselves such as searching online, taking pills, etc. Extreme mood swings, too happy, too sad or violent. Increase in alcohol and drugs intake. Acting anxious, irritated or agitated too often. If you hear someone making statements such as, "I wish I was never born," "People are better without me," "I think I am a burden," etc., then these needs concern. This is called suicide ideation, and these might be very passive suicide statements. Everyone needs to address them as soon as possible because they may trigger due to mental health illnesses or emotional triggers. I am here to tell you that even if you feel hopeless, there is always a hope. People can and do recover from the most frightening and darkest places where their mind can go to. Even when you feel like giving up, hope is not lost. Family and friends usually are the first one to identify the triggers. Seek professional help. We at The Hopes give each other the most powerful gifts of hope and care, ones that can make all the difference in relieving anguish and saving lives.